extracts. You will hear each extract only once. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check answers. Part A. In this part of the test, you hear 2 different extracts. In each extract, a health professional is talking to his patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12.
You hear a GP talking to a patient called Joshua Ferguson. For questions 1 to 12, complete the notes with a word or a short phrase. You now have 30 seconds to look at the notes.
Hello, Mr. Ferguson. How are you feeling?
Not so good. I'm not able to sit still, and the pain is so bad. It woke me up again last night.
Oh, sorry to hear that. The analgesia we've given you should take effect very soon. In the meantime, can you give me a bit more information in addition to the consultation that we had earlier? Have you had any other symptoms?
Yeah, I have. I vomited dark green liquid about 4 times.
Okay, you vomited. But have you had any unusual bowel movements? Diarrhea, rectal bleeding?
No, I haven't.
Any pain from your loin to your groin or increased urination?
Yes, the pain has spread. I also pass urine more frequently, around 5 times per night now.
Do you have any previous conditions like appendicitis or irritable bowel syndrome?
Yeah, I have irritable bowel syndrome and take mebivarine. I also take an all-in-one multivitamin. I'm not sure about the other one. What is it, appendicitis?
Appendicitis is a painful swelling of the appendix, which is a small thin pouch about 5 to 10 centimetres, and is connected to the large intestine where stools are formed.
Oh, and what causes that?
Appendicitis typically starts with a pain in the middle of your tummy that may come and go. Within hours, the pain travels to the lower right-hand side, where the appendix usually lies, and becomes constant and severe. Pressing on this area, coughing or walking may all make the pain worse. You may lose your appetite, feel sick, and occasionally experience diarrhea. It usually requires an operation to remove the diseased appendix.
I see. No, I don't think I've had that before.
Have you had a recent colonoscopy?
I'm not sure. What is that?
A colonoscopy is a test that uses a narrow, flexible telescopic camera called a colonoscope to look at the lining of your large bowel. The doctor would have inserted the camera through your back passage.
Yes, I remember that. They said it was normal.
Good. A few more questions, if I can. Do you smoke, drink, or take any recreational drugs?
Yeah, I smoke 10 cigarettes a day. I drink whiskey socially, about a small glass every week or so. I haven't taken any recreational drugs for about 20 years. I used to in my early 20s, but didn't everybody.
Okay, thank you. Regarding your examination, your temperature was slightly raised, 37.5 degrees, but all of the vital signs were normal. There's obvious severe loin tenderness on the left side. Now, the test came back and showed a high white blood cell count and positive for microscopic amounts of blood in your urine. Taken together, your signs, symptoms, and investigation results suggest a diagnosis of renal uretic colic. But it could be several other diseases we need to rule out.
But what is causing the pain?
The pain, which we believe is renal colic, is caused by the dissension of the tube that collects urine from the kidney, because the kidney stone is lodged inside. The resulting pain normally spreads and can cause the symptoms that you described of increased urination and urgency.
Is that why you took the x-ray?
Yes, and the results should be back shortly. Approximately 90% of urinary tract calculi or stones may be seen on an x-ray. If the x-ray shows complete obstruction, I would like to admit you, especially as we already have evidence of infection in your blood, that is to say, raised temperature, raised white cells, and the analgesia we've given you doesn't seem to have worked very well.
Exam 2, questions 13 to 24. You hear a physician talking to a patient called Dora Ikem Akunili. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, good morning, doctor.
Good morning. Be seated. What's your problem?
Well, I have uncontrolled blood pressure, doctor. Very recently, I had a cesarean section delivery.
Okay. What's your age?
36, doctor.
Do you have any chest pain or shortness of breath?
No, doctor, but I have fatigue. Yes, I get tired soon.
You had any previous illness or surgeries?
I have the history of hypertension, gestational diabetes mellitus.
Do you smoke or drink?
No, doctor.
Do you have any family history of coronary artery disease?
No, doctor.
Okay. What medications are you taking?
Cardizem and metoprolol were discontinued. Started on hydralazine 50 milligrams thrice a day and labetalol 200 milligrams twice a day. Hydrochlorothiazide and insulin supplementation.
Are you allergic to any medications?
No, doctor.
Well, your physical examination report shows pulse of 86, blood pressure 175 over 86, afebril, and respiratory rate 16 per minute. Neck veins are flat. Your echocardiogram shows sinus tachycardia and non-specific ST-T changes. BUN and creatine within normal limits. You have preeclampsia, status post-delivery with cesarean section with uncontrolled blood pressure, borderline gestational diabetes mellitus. I'm ordering echocardiogram for assessment of left ventricular function. I am prescribing labetalol and hydralazine to see the improvements, and based on the response to these medications, I will make further recommendations for your treatment. Now look at Part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen. Complete the answers as you listen to the audio. Now look at question 25. You hear a physician and scientist making an announcement on a finding. Now read the question. A major depressive disorder is one of the most severe, troublesome, and costly psychiatric diseases. Although there are pharmacological and non-pharmacological treatments, often antidepressants are used more frequently than psychological interventions due to inadequate resources. Our efforts are to promote the evidence-based prescription of these antidepressants in the future. Therefore, we are now focused to update and expand our previous efforts to compare and categorize antidepressants for treating a major depressive disorder. All antidepressants were more efficacious compared with placebos while treating the adults with a major depressive disorder. While the effect was lesser in the placebo-controlled patients, the variation in efficacy and acceptability was more in the patients treated with antidepressants. Therefore, these findings should promote the evidence-based prescription of antidepressants and apprise the physicians, patients, and policymakers on the merits of various antidepressants. One of the most crucial challenges worldwide is the routine prescription of antidepressants for the treatment of a major depressive disorder. Nevertheless, in the scientific literature, there are considerable ongoing debates about the effectiveness of antidepressants as well as the potential differences in tolerance and effectiveness due to individual drugs. With the introduction of new antidepressants into the market and the increasing numbers of trials published every year, we have realized the significance of systematic review and meta-analysis to synthesize the evidence in this crucial clinical issue. Question 26. You hear a physician explaining the issues involved in treating lower back pain. Now read the question. Lower back pain is one of the crucial issues in the medical field leading to disability, and it's growing alongside the aging population, which are more rapid in low-income and middle-income countries, where adequate resources to deal with this issue might not exist. Therefore, the impacts are probably extreme in such regions. Most of the lower back pain issues are unrelated to particular identifiable spinal abnormalities, and this announcement is an alert for action on the global issue of lower back pain. Typically, most of the clinical practice guidelines suggest similar approaches for the investigation and treatment of lower back pain. Their suggestions include the use of biopsychosocial strategy with initial non-pharmacological treatment, including the suggestion of self-management and resumption of exercises, normal activities, and psychological programs for those with continuous symptoms. Nevertheless, recommendations are mainly based on the trials exclusively from high-income countries, focusing mainly on treatments rather than its prevention. Therefore, there is a massive gap between evidence and the existing practice. Without the use of suggested first-line treatments and inappropriately high use of imaging, spinal injections, opioids, and surgery. Following similar strategies will never reduce back-related disability or its consequences in the longer run. The effective treatment will be those which align the evidence with practice, focus less on spinal abnormalities, and suggestions of activities including work participation. Although we have devised effective and promising solutions that require greater attention and intensive research to establish whether they are suitable for larger-scale implementation. These potential solutions include the redesign of clinical pathways, focused strategies to implement best practice, integrated health, and occupational interventions to reduce disability with prevention strategies. Question 27. You hear a doctor explaining to the nurses about the growth hormone test. Now read the question. Growth hormone test. The growth hormone is very essential for the human body to grow. To find out why the growth of a child is slow, a growth hormone test called arginine and clonidine stimulation test is performed that will indicate the secretion level of growth hormone in the body. The child will be injected with two types of medicines during this test, namely arginine and clonidine, that will cause the body to secrete the growth hormone. Biochemically, the growth hormone reserve of the child is defined by the peak serum concentration after stimulation with a known secretagogue. While performing the test, nurses draw 5 blood samples at specific intervals to observe how many growth hormones the body is secreting. Prior to the test, the child should not be allowed to eat or drink anything except water after midnight. The test takes about 6 hours, so the child should be clothed comfortably. Generally, a short-sleeved shirt is suggested during the test. The nurse on duty should make sure whether the child is on any medications before scheduling this test, and they should explain to the parents of the child about the process and outcome of this test. The test will be performed in an endocrinology outpatient clinic, and the nurse should measure the weight and height of the child. Then the child will be taken into the patient room equipped with the intravenous catheter, which is used to inject the arginine into the child and to take the blood samples. However, the clonidine will be fed through the mouth in liquid or in pill form. This may lower the blood pressure and cause the child to sleep, so the nurses should keep on measuring the blood pressure of the child during various intervals. The child may be given fluids to drink during the test. However, before discharging from the clinic, the child should be able to eat and walk around. The child may feel tiresome throughout the evening. Question 28. You hear the announcement of a new milestone in cancer treatment. Now read the question. A milestone in cancer treatment. Cut, burn, and poison is the expression that describes the traditional 3 steps involved in the cancer treatment. Specifically, the expression means to cut out the growth of the cancer tumor, burn the carcinogenic cells with radiation, and poison those that remain with chemotherapy drugs. Interestingly, a young doctor from the U.S. proposed another method to treat cancer about 30 years ago. He thought that abandoning the blood supply to cancer tumors could block their growth, but many scientists dismissed this concept for a long period. However, last month, the Food and Drug Administration of the U.S. approved the drug called Avastin that works the way he proposed. Although the drug does not cure the cancer, it increases the lifespan of the patient with colon cancer. Avastin is a genetically engineered protein that connects with the protein in the human body that promotes the growth of the blood vessels. The protein, also known as vascular endothelial growth factor, intervenes with the supply of blood to cancer and starves the cancer cells. Avastin targets the weak places of cancer cells, though it does not damage normal tissue, whereas chemotherapy kills cancer cells and also the other normal cells, resulting in infections along with stomach and intestinal problems. There are also other drugs being tested to investigate whether they can stop the formation of blood vessels. In the past 2 years, Avastin is one of 3 new drugs approved for colon cancer. Question 29. You hear a physician explaining how to treat an intermittent explosive disorder. Now read the question. Intermittent explosive disorder. The intermittent explosive disorder involves spontaneous, impulsive acts of aggression that may take the form of spells or attacks. The symptoms may begin minutes or hours before the actual act. A person with the intermittent explosive disorder may have the frequent history of such occurrences. The intermittent explosive disorder can be connected to something in our surroundings or some kind of action within our body. Due to the abnormality in the area of the brain that controls the behavior, some people may show more explosive behavior, while others may develop the intermittent explosive disorder as a result of a severe explosion or violent actions occurring around them. People with the intermittent explosive disorder often show aggressive behaviors that are impulsive, and they often become out of proportion to the situation. They may experience the feelings such as rage, a racing heart, irritability, or sudden burst of energy. Often the patient with the intermittent explosive disorder will feel relieved from built-up tension, while many with such a disorder blame others for causing them to outburst aggressively. However, they also feel guilt and remorse after the outburst. There are various types of drugs to control the intermittent explosive disorder temporarily, such as certain anticonvulsant mood stabilizers, antidepressants. However, the therapy involving cognitive exercises challenging their negative perceptions was found to be effective in controlling the intensity and frequency of intermittent explosive disorder. Question 30. You hear a doctor briefing the junior doctors about trigger point injection. Now read the question. Trigger point injection. Often muscle spasm prolongs and doesn't respond to regular treatments like ice and heat, physiotherapy, or muscle relaxants. In order to relax the muscle, either a local anesthetic or a combination of local anesthetic medication and a steroid medication will be injected into the tight bundle of muscles known as trigger points. In this process, the skin of the patient will be cleaned and chlorhexidine and a small needle will be inserted into the trigger point muscle. Generally, up to 4 trigger points are injected in one session. However, when injecting up to 10 trigger points, the patient will feel very painful. It is essential for the patient to inform the physician when the needle contacts the painful trigger point, as this is where the medicine has to be injected. They may feel a temporary discomfort. There can be many possible complications after a trigger point injection, including mild bleeding and skin irritation and infection. Although the positive result of the treatment cannot be ascertained, the local anesthetic will numb the area for 3 hours. The corticosteroids remain in the tissue in active form for about 1 month.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete the answers as you listen to the audio. Now, look at Extract 1. Extract 1. Questions 31 to 36. You hear the lecture given by a physician on the topic white blood cell disorders. You have 90 seconds to read questions 31 to 36. White blood cells are predominantly involved in fighting infections and participating in inflammatory reactions, while red blood cells carry oxygen to the body. Platelets help stop bleeding. The normal number of white blood cell ranges from around 4 to 11 billion cells per liter. Newborn babies have a higher range from around 9 to 30 billion cells per liter, which goes down over the first 2 years of life and is similar to adult normal ranges for the rest of childhood. Opposed to red blood cells, the normal range is not affected by gender. However, it is affected by race. In national studies, African Americans have lower baseline white blood cell counts than Caucasians. There are several different ways to categorize white blood cell disorders. First, they can be categorized by cause, those that affect white blood cell production and other factors that affect the function of the white blood cell. Secondly, white blood cell disorders might be categorized by which type of white blood cell is affected. In some disorders, all the white blood cells are affected, but others only affect one type. There are 5 major types of white blood cells: neutrophils, which predominantly fight bacterial infections; lymphocytes, which predominantly fight viral infections; monocytes, which predominantly fight fungal infections; eosinophils, which predominantly fight parasitic infections and are involved in allergic reactions; and basophils, which are involved in inflammatory reactions. Thirdly, white blood cell disorders can be classified as benign or malignant. The majority of white blood cell disorders are benign. Generally, too much of one type of white blood cell is suffixed with philia on the end of the word, and too few of one type of white blood cell is suffixed with penia, which is applicable to all types of white blood cells. For instance, leukophilia is a white blood cell count above the normal range, and leukopenia is a white blood cell count below the normal range. These can also be applied scientific white blood cells, such as neutropenia, with too few neutrophils, or basophilia, with too many basophils. Leukophilia is an increased number of white blood cells. The most common causes are infection, medications like prednisone. Autoimmune neutropenia occurs when the body secretes antibodies that attack and destroy neutrophils. Patients with severe congenital neutropenia are born with severe neutropenia secondary to genetic mutation and have recurrent bacterial infections. Cyclic neutropenia is caused due to genetic mutation, similar to severe congenital neutropenia. However, the neutropenia does not occur every day, but in cycles of about 21 days. Leukemia is a cancerous white blood cells produced in the bone marrow. Chronic granulomatous disease is a disorder where multiple types of white blood cells become unable to function properly. It is an inherited condition and results in multiple infections, particularly pneumonia and abscesses. Leukocyte adhesion deficiency is a disorder where the white blood cells are unable to move areas of infection.
Now look at Extract 2. Extract 2. Questions 37 to 42. You hear the discussion between a senior doctor and junior doctors about pemphigus. You now have 90 seconds to read questions 37 to 42.
Hello, Doctor. Can you please explain what is pemphigus?
Well, pemphigus is the term used to describe a group of autoimmune diseases which cause the skin and mucous membranes to become blistered. The diseases may affect areas of the body such as the mouth, eyes, nose, throat or genitals. In certain cases, these diseases may be fatal if they are left untreated. Pemphigus disease affects the people from different and ethnicities. However, some studies have shown that individuals of Mediterranean descent and European Jewish individuals are more prone to these diseases. One form of the disease is very common among people who live in the Brazilian rainforests. Pemphigus affects men and women equally, and several studies have proved that the diseases are associated with a genetic predisposition to developing them. The onset of disease symptoms usually begins during adulthood, although symptoms have been found to occur in children. Depending on the layer of skin blistered and the location of the blistering, there are several forms of pemphigus. The blisters always appear on or near the skin surface. Pemphigus vulgaris is the most common form of pemphigus, which affects the mouth first. That can be painful. The blisters will start appearing on skin and mucous membranes that were looking healthy previously. They form inside the deep layer of the epidermis, making the skin so delicate that simply rubbing it with a finger causes it to fall off. Normally this kind of blisters heal without causing any scarring. However, some parts of the skin that have become pigmented may last several months. Pemphigus foliaceus is another common type of pemphigus, in which blisters or crusty sores initially develop on the scalp and face. However, other areas of the body, such as the chest, is affected at a later stage. Often the lesions are itchy, but are not as painful as those that develop in pemphigus vulgaris. Areas of the skin may become moist, loose and scaly. Paraneoplastic pemphigus is a rare condition that is not actually pemphigus, but shares certain characteristics of the disease. It develops in individuals with certain cancers and results in ulcers forming in the mouth and on the lips. The skin also becomes blistered and the eyelids may become cut and scarred. The antibody that binds to the surface of epidermis cells also targets the membranes of the airways, and hence patients with this condition can develop fatal lung problems. In the IgA pemphigus, the immunoglobulin A, an antibody different from other antibodies, is involved in other forms of the condition, binds to the epidermis cell surface. The blisters are similar to those that develop in pemphigus foliaceus, but at times they are pus-containing bumps. IgA pemphigus is the least harmful type of pemphigus. Pemphigus vegetans causes thick sores to arise under the arms and in the groin area.
That is the end of Part C. You now have 2 minutes to check your answers.